Yeah, good day everyone. My name is Jimotaya Bumuiz, and the topic before me today is measuring blood pressure, counting of radial pulse, and pulse deficit. Today, basically, when you want to measure blood pressure, you have to take up some procedures like go through hand hygiene, and we need some equipment. So these are our cuffs. This is the bulb, the sphygmometer, and the stethoscope. This is all you need for the whole thing to for measuring of blood pressure. Firstly, you ensure that the patient is seated and the person's arm is at chest level, and you take the blood pressure from at the cubital fossa to locate the brachial artery just at the center of the cubital fossa here, then go medially, then pressure, then you can feel the artery here. So let me just why choosing our choice of alcohol curves depends on the size of the person's arm. So these are there. So first we close this bulb so that the pressure can be felt here, and you ensure that your your stethoscope is working so that you'll be able to hear the the cough sound. So immediately you pump to when you stop hearing the pulse. Then at that point, we can as well use this place just in case you don't have your stethoscope around. You can use the radial pulse just by using these three fingers and holding down. Then you feel the pulse around this region of the hands. So the moment you hear you can't hear the sound, the pulse anymore any longer, you pump 30 mercury meters above, then you release the at a very unit, like you release the pressure. So the first sound, the first pulse you hear, that will be your systolic, and the last sound will be our diastolic. So in this case, we will run that now. So so Mr. Daniel. Okay. So our result is 100 over 74, which still falls within normal range. Okay, for the radial pulse, we can simply use these three fingers, the proximal, middle, and the distal. We use the middle to feel the pulse. You press against the radial bone here, and you count under 1 minute. But in real cases, you can count in 15 seconds and multiply by 4, or in 30 seconds and multiply by 2. Then the pulse deficit is when the the pulse counted here at the radial is different from what is counted at the heart, at the apical part of the heart when listening through stethoscope. So, and this can be due to atrial fibrillation or ectopic heartbeat.